Medical Center, as I mentioned, to talk to us all about how the hospital stays so clean and the work that it takes to keep it that way. Utahna Ortiz is here. She is the Manager of Environmental Services at San Juan Regional Medical Center. Welcome back to KSJE.
Good morning.
Nice to have you here, and it's a big job, isn't it, to keep the hospital so clean?
Very much so. Very much. Have a lot of square footage, the hospital and all of the clinics and all of their buildings.
Exactly. And so how big a staff do you have to do all of that?
I run around a 72
That's a lot of
staff.
people.
Yeah.
That is a lot of people.
Yes, it is.
And that includes, as you mentioned, the clinics, not just the hospital proper then, but all the other outbuildings and other sites, I guess, around the area too, correct?
Right. The San Juan Health Partner clinics, Durango, to an Aztec, and all the buildings that surround the Farmington area, we do clean it.
Got it. And so now, obviously, some areas need more cleaning than others, I assume, right? And so, in a real high cleaning area like an OR or a patient room, I guess that's what gets maybe a lot of attention. Is that how it works?
Right. We do terminal cleaning and the operating room, the emergency department, endoscopy, where they do invasive procedures. And so there's a lot of research, and we do behind the scenes to ensure that our patients are being safe and that they don't require any hospital-acquired infections. So that's our responsibility, is infection prevention.
Right. And that can be a big problem, I guess, if you're not careful. And other hospitals have had that situation. And so you have a piece of technology, which is one of the reasons I wanted to get you back and talk about it here, because I think it's so fascinating. It's actually a robot that helps to really make sure that when a room is clean, it's really clean.
Right.
And talk to me a little bit about that.
Right.
That's really interesting.
So we've acquired the Tru-D system 11 years ago. Now 11 years has passed, so it's now considered the classic. We had two of them, and this past year we upgraded one of them. And so we went to the new Tru-D IQ system. It's a tower and a scout, so it's a 2-in-1. We use this machine after my environmental services staff. They go into patient rooms and they terminally clean it, and afterwards this goes in as an additive. It doesn't replace my staff at all. It's just an additional investment that we made to ensure that the patient rooms are clean.
Gotcha.
Yeah, and how it works is that it uses UV technology. And
ultraviolet.
Ultraviolet. And it takes bacteria and microorganisms, and it breaks it apart so it doesn't regrow, so it's not infectious anymore. It changes the structure of that germ.
Interesting. And so it's actually cleaning the air in the room, right? It's not scrubbing the floor. It's not like a giant Roomba or things like that. It is really just specifically cleaning these viruses and things that could be in the air. Is that the idea?
Well, right. In healthcare, we're more concerned really is about the things that you cannot see.
Right.
Wiping down everything in the room. And so because like C. difficile, for instance, that's something we do have in the community, and it could live up to the surface for 6 months if it's not cleaned properly. So, and we don't use your typical disinfectants, your Mr. Clean, your Lysol, the stuff that you buy from the store. We use a Sporecide, and it's it's a hospital grade disinfectant. It's very top of the line, and we use it in all of our rooms daily.
Got you. But the robot is using that ultraviolet light to kill these things that it sees, and that I guess that's in contact with those beams of light. Is that kind of the idea?
Right. It is. Yeah, it goes into the room and it kills everything in the room. It's 99.9% effective, and like I said, that's what it does. It's after the housekeeper. So if a patient is admitted that has either C. diff, MRSA, COVID, and the housekeepers, they go into there, they don their PPE, terminally clean it, which are mopping the walls.
That personal protective equipment, that PPE, right?
Right, PPE, I'm sorry, yeah, personal protective
equipment. It's been a while since we heard that term during the COVID years. We heard it all the time, but just to remind everybody.
Yeah, and it's just second language to us in healthcare. We do wear that every day, and so going into these rooms to protect ourselves, and my staff, they go in there, terminally clean it, and then afterwards they're done with the room, we add this as an additive. So it's very cool technology.
Right, and I guess the other thing that I'm noticing noticing from the videos that we're sharing and some of the photos is it's in the room by itself. Because of that ultraviolet light, it really can't, a human can't really be in there while it's working.
Right.
It does it on its own.
Right, it's unsafe. And so there's a remote control that you take off the machine and you lock the whole room down, and then you turn it on. It doesn't go penetrate through glass.
Right.
So you're able to see it if you would like, but we do, like in rooms that do have the glass doors, we do close the curtain just because I think it makes people uneasy.
Sure.
Like, what is that machine?
Yeah, what's going on
What's
in
with
there?
that blue light? Yeah.
Exactly. But as you mentioned, it sends you a little note when it's done, I guess, a little text, a little message or something,
Yeah.
right? So you know when it is done.
That's what it does. And that's what's great about Tru-D, the IQ system, and that Tru-D specifically is that it's measurable. So when you put it into the middle of put it into the patient room, it calibrates and it uses those UV technology, those lights to measure the room. And it'll tell you, and each room varies. Depends on the size of the room, the equipment you have in the room, and it'll calibrate and it'll tell you, hey, it's going to take me 20 minutes to disinfect this room. And it'll text you and say, hey, come get me, I'm done.
Right. Okay, interesting. And now this doesn't replace the other cleanings that your staff does, and wipe downs and mops and cleaning the room, the walls and everything else that they do just normal.
Right.
Course of a day, I guess, right?
Right, that's absolutely right. It doesn't replace my staff at all. My staff are very valuable to the organization, and we, I do enjoy working with them every single day, and they do a very good job.
Right. Now, these things, I imagine, are not cheap, right? And you have two. You have the newer one and the classic one. And so this is an investment, I guess, in this kind of technology, and you felt that the classic one was working so well that it boded well to invest in the newer one?
Right. We do, and these machines are very expensive, and we invested, and we were able to acquire that with our partnership with Aramark, and so they cost around $100,000.
That's a lot.
Yeah, it is a lot.
Right. But they do a unique job, I guess, which is the other side of that, too, because I don't know if you didn't have this, how you would be able to clean those potential viruses and things like that out of those spaces without some kind of, I don't know how you do it.
Well, we do
I'm sure there's a way to do it.
There is.
Yeah.
We do quality measures on the housekeepers. We have this to ensure that our patient rooms are clean adequately. We do glow lights. What glow lights is an invisible marker. Go around the room, you mark all the high touch areas, and then the housekeeper cleans it. We come back afterwards and we have a little black light, and we check to see if they've gotten all the areas. And if they did, I reward them with a meal ticket to go upstairs and have a free meal on me. But it's also a teaching tool. And so if you're like, hey, you know what, you're rushing, we need to slow down. And then we go over the process of how important it is for our patients to be admitted into safe, clean rooms. Because I'm a big believer in a clean environment is a healing environment. And I think we heal better if we feel like we're in a safe, clean environment.
Sure, that's true. But now you can't do that every time, obviously. This is just maybe a spot check on your folks from time to time and see how they're doing, or for newer folks who are coming onto your staff.
Right, that's what we also do. And then we do this, my supervisors who help me, great asset to my team. I have an amazing team and a management team, and they help me with this. So we do an average, 10 to 12 per day. We, as much space as we clean the clinics and the hospital, we got to be all over the place.
Yeah, that's true. Well, and again, each area, whether it's a patient room or a clinic, probably needs a different level of clean and different things to check. Those high-touch areas are different from space to space as you move around.
Absolutely. Exam rooms, patient rooms, your restrooms, the operating room, the cath lab, endoscopy, they're all cleaned very differently.
Gotcha. Now I feel bad when I was at my doctor's appointment for touching everything in the room. I'm so sorry, but that was me. That's okay. Another thing I want to ask you, though, is laundry. And you were telling me before I came on the air this morning just how much laundry the staff does and the hospital creates in any given year. So for folks who don't like to do laundry, your staff does it a lot and washes a lot of linens and everything else, I guess, right?
Right. We do. And that's just your base, the stuff that you see in your patient rooms every single day. The spread, the blanket, the sheets, towels, all that stuff. And so we average a little over 1 million pounds per year. Can you imagine doing that in your household?
I just want everyone to let that sink in for a minute. 1 million pounds of laundry a year produced from the hospital and cleaned at the hospital. That's amazing.
Well, it's actually done by a third-party company,
Oh, is it?
but yeah, but
Okay.
in-house we do a lot too as well.
Okay, you do have some laundry machines,
We
and washing
do.
machines there just for emergencies, I guess, right?
Yes, emergencies, and we also do. We time to time get patient requests to like someone who's out of town and in our facility for a few days. We do help them by washing their laundry, so when they get discharged, they're left in clean clothes.
Nice, very true. But that third party then that's dealing with that 1,000,000 pounds of laundry, that's got to have trucks coming and going all the time.
Well, 3 times a week. We
Okay,
have a
all right.
system down. 3 days. It's a big truck that comes and uploads our soiled linen and collects our clean.
Gotcha. And I imagine they have certain priorities and standards for cleaning. They're not just throwing it in with a Tide Pod or something. They're doing something a lot more cleanly and a lot more industrial strength, I guess, right? For the
Right.
stuff that you're sending them,
Right.
right?
There's no gain. There's no Tide, bleach, any of that stuff. There's hospital grade chemicals, and we use the exact same one in my facility, in the laundry facility as well. We have to follow the manufacturer's guidelines, and you don't really know this until you actually get into the field. You have to program the machine specifically and they're all cleaned differently. A washcloth's not laundered the same as a sheet. A towel's not laundered the same as a blanket. So they're all very different. And so you program your machine specifically to, the chemicals, everything. And we do very well. I get my in-house at the hospital. We do microbial testing, which is after the items go through the laundry, the washer and the dryer, I send it off to a third-party lab where they swab it, and they do petri dishes. They put on a petri dish, let it incubate for a certain amount of time, and I've been very fortunate, and we have not had any growth, so we've passed those flying colors.
Nice, very important. And so that's another, I guess, just quality control step that you take to
Right.
ensure that the stuff is coming back as clean as it's supposed to be before it gets onto the bed in a patient's room
Right.
or a towel or whatever else is being used for patients or staff. And so that's an important thing as well. Very, very interesting. What else is some of the things that your staff is doing? What are some of the other areas that they look at when you go to a clinic? Let's say they're cleaning the lobby, the exam rooms, and all those other different spaces, I guess.
Right. Everything all the clinics and all of the buildings are cleaned nightly. We do machine scrubbing. We do floor care. We do a lot of cleaning every single night and quality measures. Like I said, it's a very big operation that we run, that we're responsible for the cleanliness at the hospital and all the clinics. So far, we're up to 31 buildings, and that's a lot.
It is a lot.
It is a lot, yeah.
Right. In 2 states.
In 2 states,
Yeah.
yeah. One in Durango and all the rest of them here.
Here, of course, right. So interesting, very, very interesting. And for something as maybe a high-use room, like an operating room or something like that, that probably needs to be thoroughly cleaned between each and every procedure, that's a different level of clean, I guess, right? And a different level of operation for your staff.
Right. We do between case cleaning, and when the patient gets left from the operating room, we go in there and clean it. And then at the end of the day, we also do an additive, which we're scrubbing the floor, and we also terminally clean it at night and then run Tru-D there nightly.
Got it. And in something like an operating room, are there multiple operations scheduled in a day in those spaces, or is it usually? I guess it depends on the traffic, of course.
Right.
In the census, but I mean, could an operating room see several procedures in a given day and need cleanings in between all those?
Yes, there is. There's multiple cleanings that happen throughout the day, multiple cases, but that's not really my realm. It's more of the operating room. But the cleaning part, yes.
I hear you. Okay. And for just a normal patient room, when you bring in Tru-D and your staff does the other thing, about how long does it take for those procedures? I guess the Tru-D takes a certain amount of time when it scans it, and then the rest of it too.
Right. So the classic, and that's what one of the benefits of upgrading our system, the Tru-D to the newer one, is that the classic used to take anywhere between 45 minutes to an hour after we got done cleaning it. With the new system that we have, it's a lot less. And so right now there are bigger rooms that we're running 45 minutes are taking anywhere between 20 to 30 minutes. So we turn the room around quicker, and so that way the nursing knows that the room is ready for the next patient admit that needs to come into our facility.
Got you. So that's got to be helpful.
Very helpful.
Especially during busy times, like maybe cold and flu season or other sickness seasons and things like that, when folks are needing a room and needing a place to stay to get better, of course. And so that's really important. I did want to ask you too. You mentioned some of the other viruses and other things that can cause real problems, MRSA and other infections and things like that, if they're not controlled. And so that's got to be a constant concern with you and others at the hospital, certainly, to try to keep that and not even have to deal with it, ideally, right? And just not even stop it from starting, or not even start it from, anyway, get a handle on it, is what I'm trying to say, pardon me. But that's got to be really important, though, to make sure that those things are kept in check.
Right. They are these patients who test positive for MRSA, and they required contact precautions. They're placed under isolation rooms, and that's a notification to my staff. Okay, I need to don my PPE when I go in to protect myself, and then I also they're taught a different method of cleaning when they go into the room. So we're thorough in the room, wiping down all the high touch surfaces, and then when we leave the room, we, take off all of the precautions, letting the nurse know we're done with it, put Trudy in the room and say, hey, we're done. You can admit your next patient into this room.
Right, and that's an important thing. And it's just, again, it's case by case, obviously, so that they know that room was a patient with this, was in that room, and it requires a certain level of cleaning and things along that line. So that's what it would be. Now, before I let you go, last time you were here, I asked you for some tips for all of us to keep our houses cleaner, and you gave some really, I think, really important tips and really interesting tips that I've been using since you were last here with me, and so I appreciate that. But for folks who are hearing us for the first time, what are some of the things that we can do now? If we don't have an ultraviolet robot, what are some of the things that we can do in our own houses on cleaning day to get that extra level of clean?
Well, one of the tips that I shared last time is that, each of the disinfectants that you buy over the counter has a wet time. And so you look at the rear back of the bottle, you're going to see times on there. So when you spray your Lysol or, the disinfectant that you're using on a surface, it has to set for a certain amount of time for it to kill all those germs. And so oftentimes what we're used to doing is we spray our surfaces with Lysol, and then we're taking a paper towel and then we're wiping it down immediately. And so then you're not adhering to killing all those germs.
We shouldn't do that.
Yeah, so a little longer, or I recommend that you use a microfiber product. Those are just a lot more effective. If you look at the technology and the literature behind it, it's a lot more effective than paper towels or your terry cloths that we use at home. So.
Interesting.
Yeah.
And about how long? I know it probably differs from product to product, but how long is the average wet time? Would you say? I mean, is it
10 minutes?
10 minutes.
Usually 10 minutes. And you can't, that's hard to justify. But in our hospital, we use a 3-minute one, and so that's pretty quick to turn when we're wiping down all the surface. That's why the housekeepers, they pre-soak all of their materials, so their disinfectant, their sporicide that they use is soaked in a bin of microfiber rags, and then they use that when they go into the room. So they pull one
out, it's ready to go.
Then they change them out every single room. They never reuse it. We use microfiber pads too. It's very popular now. They're like a flat mop. A lot of people can think of it like a Swiffer. And so in the hospital, we use that because you sweep and mop at the same time, and you save yourself from having to use a broom and go wiping everything down or sweeping your floor. And then the microfiber, your dirt is considered negative, and your microfiber pad is considered positive, so it sticks together.
Gotcha. That's helpful too. But interesting that there's this wet time, and I think a lot of us will spray something and just immediately wipe it off, and that's probably effective, but not as effective as it could be. You're saying it still cleans, but it could clean better if we just wait that few minutes. Got it. Okay. Well, any other things that we could be doing in our homes that could help?
I think a lot of the auto scrubbing now, the little, I use them in my home. And so instead of mopping, I use it's a little like a vacuum cleaner that has a jet in there, and it scrubs the floor at the same time.
Okay.
So when you mop, you are...
Like a wet vac kind of a thing?
Yeah, like a little wet vac kind of thing. So when you're sweeping and mopping at home, you're using a broom, and then you're using a mop to that. And so the mop, you're just spreading the dirt from side to side. Now, when you use those little machines, you pick up you're scrubbing it, cleaning it, and you're picking up all that dirt. And so when you look at your dirty container of it, you're like, oh my God, then you compare it to.
Always awful.
It's always awful. I'm like, I take off my shoes, I make sure they're, and it still is just, dirty. But that's something that I use in my home, and so I make sure my house is clean. I have 3 children, and so they're. Yes.
Then
yes.
What you're talking about. That's for sure. And then, of course, there's no carpet really yet in the hospital rooms that your crews are cleaning. And so, any advice for rug cleaning at home? Is it still kind of the wet vac type of situation sometimes?
Yeah, we use an extractor on ours. That's what we use to keep them clean. Yeah, and those are, you find at home that you find them in the store and that stuff to do the extractor, and that's what we use at the hospital. But in a hospital setting, in a healthcare setting, that is something that's just not ideal. You won't find that at all, because how do you disinfect carpet? How do you clean that, really? You know what I mean? So, and from a patient perspective, that's just something, I don't know how to disinfect it at all, to be honest.
Very true. Well, you don't have to, because there's linoleum and the other tile and things like that that are easily cleanable in those high touch surfaces and things like that you're talking about.
Right. All the patient rooms have non-porous surfaces, so you don't have the cloth chairs inside of the room, so everything in a patient room has to be wipeable, so that way we can ensure that it's being disinfected.
More like a vinyl leatherette kind of a thing, right?
I often get compared to hotels, it's not, I was, when I interview staff and tell them that, I can do that it's different, because in a hotel setting, they remove the bedding,
sure.
And they take off all the sheets. They don't wipe down the bed. We wipe down the bed.
Right.
The chairs in the room and the pull-out couches, that's a cloth surface. Ours are not. Ours are wipeable surface. So we pull all of that, wipe everything down. So it's a little different.
Sure.
Yeah. Taking down the curtains, something you don't
think about. No,
when
but
you
do.
Yes, I do. I do when I go to hotels. I'm like, oh my God, I'm just not a good companion to go to. When you go to a hotel, like, oh, this is
hasn't been cleaned in a while. We've all stayed in hotels like that, I'm sure.
Yeah.
But that's the difference, and that's the reason, I guess, and it's interesting for folks, I think, to learn that, of the reason for some of the furniture choices in some of the rooms and things like that is because of its cleanability, for lack of a better term. But that it really helps, to have a nice chair for a visitor to sit in. But it's not a fabric chair. It's going to be probably something that can be wiped down and kept clean from use to use.
Right.
And that's the reasoning behind it. That makes a lot of sense.
Absolutely.
Very good. Well, Utahna Ortiz, I really appreciate you coming in and speaking with me. It's a big job for you and your staff at the hospital and all the other properties around Colorado and New Mexico to keep clean and keep patients and staff safe. So thank you.
Thank you. Thank you.
Thanks for being here. My guest this morning here on KSJE.